Thank you all for joining us at AUBMC for this special lecture where we will hear firsthand from Dr. Ghassan Abu-Sittah about his experience volunteering in Al-Shifa Hospital in Gaza. The images of the war on Gaza will haunt us for a very long time. Unfortunately, these images we have seen time and time again in the past. Images of the elderly, innocent women and children injured, burned, or lifeless. Friends, these are images that we have seen one too many times, and my sincere hope is that we never see them again. We at AUBMC are committed to doing our part and all that we can to support the people of Gaza. Our mission has been and always will be to care for the people of Lebanon and the region. When we think of a humanitarian disaster occurring in Gaza, the most effective and impactful and lasting initiative we can undertake is to help provide the people of Gaza the medical expertise and knowledge they need within their own city. Although the impact of volunteers such as Dr. Abu-Sittah and others is tremendous, building the internal capacity within Gaza is the best way for us to empower the people on the long term. AUBMC will be working on providing Gazan healthcare professionals with the proper training needed to strengthen the local healthcare system, giving them the ability to provide the standards of care to their community. As an academic medical center, we are dedicated to sharing our knowledge and resources, elevating the level of medical education and training in Gaza. Over the years, we have trained hundreds of physicians and nurses from Palestine and other Arab countries, and we vow to do more. In order to meet these ambitious training goals, we will be working and partnering with the Welfare Association, and we will need your support, each and every person in this room. Before I give the floor to Mr. Faisal Alami from the Welfare Association, I want to take a moment to say a few words to Ghassan. We know this is not your first time volunteering in Gaza. Unfortunately, it's the third war in which you have bravely served the people of Gaza in dire need of medical care. On behalf of the entire AUB and AUBMC community, I wanted to say that we are inspired by your courage, dedication, and sense of humanitarian duty to the people of Gaza and the region at large when needed. We are proud of all that you have accomplished, and we appreciate all that you do. We hope that we are all Ghassan Abu-Sittahs. Thank you.
Thank you, Dean Saif. Now I would like to welcome Mr. Faisal Alami on behalf of the Welfare Association to say a few words.
Dean Dr. Saif and friends, Dr. Ghassan, Dr. Ghassan, thank you very much. I would like to thank AUB for hosting this lecture and offering the partnering with Welfare Association. As Dr. Saif has just indicated, that we will be working on funding various programs, through the medical programs needed. I'm not going to talk about the atrocities of war crimes happening in Gaza since early July, but can't help but remember the 82 siege of Beirut, and when more than 20,000 Lebanese and Palestinians were killed. 20,000 indeed, we kept looking for that figure because we thought it was a wrong figure. When in 82, the difference is that the tragedy of the Gazan situation is multiplied by the fact that there is no way out for our people and no way in for support, whether it's humanitarian or medical or of any kind, except a few like Dr. Ghassan, where this is very, very important. The percentage of people killed in the last 45 days If you think of it, okay, it's almost 1% of the population of Gaza, which is like, 45,000 Lebanese, or if you want to take it proportional to the population in the United States, it's like having 3.5 or 4 million killed, so it's just very, very drastic. Okay, the Welfare Association initiated immediate emergency intervention, okay, for many components that included humanitarian aid, including food, clothes, medical supplies, psychosocial care for children, programs supporting families, namely orphans, programs supporting the disabled, and direct financial aid for families. We have raised so far in our appeal about $9 million, okay, and this is for emergency relief, okay, and the intermediate plan is to fund projects badly needed for more than $50 million, okay. We're working with various partners and agencies to whether to do the fundraising or the implementation. We have many donors working with us, and we have many NGOs on the ground who are our partners to do a lot of the work needed. Such partnerships are very important for us. After the 2008 war in Gaza, for example, one of the programs we developed is Mustaqbali program, whereby more than 1,200 orphans were orphaned during the war of 2008. And through a partnership with Abraj Capital, a private company, $10 million were pledged to raise those orphans, basically host them in their homes or the homes of relatives rather, and to take care of them from their current age till the age of 24 when they are supposedly, they are educated and can take care of themselves. This number grew to 1,800 by last year, so we had to fundraise for more, another 10 million, so the whole program is 20 million. Now this war, okay, we expect that there's at least a similar number. We don't know the statistics yet, but what's more devastating is that many of them don't have relatives to host them, and they have to be hosted somewhere, at least there is, we know, a few hundred, 200, 300, So the welfare is preparing a program that we're looking for partners and funders, okay, a type of village like the SOS village, that we would be working on. So this is going to be called Mustaqbali 2. We're not going to fundraise for it here, but we have other programs that we will target to fundraise in Lebanon. Okay, the Welfare Association Lebanon Branch Board, when they met with Dr. Ghassan, who's a member of the board, after he came back last Monday, I think, or Tuesday, we decided that we will undertake, okay, a targeted campaign on the medical relief of the people in Gaza. We will send immediate relief through providing medical supplies, if feasible and as needed. Some supplies are straightforward. Also, we'll work on medium-term needs to provide training for doctors and nurses, as Dr. Saeed said. And on the longer term, I think we will select a target hospital to be rehabilitated, mainly the Trauma and Rehabilitation Center in Rafah Hospital, Abu Yusuf Najjar Hospital. So the target budget of the campaign in Lebanon, okay, will be about 5 million. Okay, I won't keep you from Dr. Ghassan, who is an amazing human being and doctor and friend, so I leave the floor to him.
First of all, I'd like to thank all of you for taking the time from your working days to join us here. I'd like to thank all my friends and my colleagues who have been extremely supportive, not only in my endeavor to try to make my way to Gaza during this war, but my colleagues who've sent messages that came across the internet while I was in Gaza, my colleagues at the Department of Surgery who supported my trip, and my colleagues at the Division of Plastic Surgery and the residents included who looked after my patients, and my patients who put up with my absence, and many of them delayed surgeries until I returned. So since July the 7th until the 17th of August, it's estimated that between 18 to 20,000 tons of explosives were dropped on Gaza. Gaza is 360 kilometers square, 14 kilometers by 40. And the devastating effect of such a concerted attack that did not spare any single part of Gaza has been carnage on an unprecedented scale. I had the misfortune of having been to the war during the war of 2008-2009, and again in 2012. And the sheer amount of death and destruction does not compare. I met a relative who as the upper limit of age. The devastation that this number of children will leave in a society such as Gaza will be long-term, and the gaps that these children will leave in the families will take a long time. What has also been extremely disturbing about this war is the number of families that have been wiped out. In Gaza, because of the lack of land, people build enough foundations so that when their children grow up and get married, they are able to build on top of it. So a 4 or a 5-story building will have 3 to 4 generations of the same family. When a 1-ton bomb or a 16-kilogram bomb is dropped on a building that's made mainly of grease block, these bombs have been designed to penetrate mountain encampments. The result has been that 77 families, almost 480 women, men, and children were wiped out. Targeting of paramedics and ambulances has meant that 83 doctors, nurses, and paramedics have been killed. Injured. 23 were killed, including paramedics. Of the 83 ambulancemen that have been injured, the overwhelming majority have either severe injuries or have been left with amputations in the limb. During the war, there were several ceasefires that had been declared by the Israelis and then broken by the Israelis. The most horrific was on the morning of Eid, when the Israelis declared a unilateral ceasefire. There was a fairground close to Shatat camp which had Ferris wheels and swings. And when the children were settled in this fairground, the Israeli jets fired on this fairground, killing 30 children and injuring another 50 children. The picture at the bottom is of one of the patients who had still been holding the money that he was going to pay. 10,193 were injured. When such high payload ordnance is used, there are very few light injuries. The majority of the patients that I have operated on, and I was doing between 5 and 7 cases a day, will be permanent disability or deformity. 33% of them are children. The girl on the right, the bottom right, who we operated on, has lost her elbow joint. So despite the smiles, that is going to be a non-functioning hand. The other phenomena that was